house on top of rotten boards when you're using.
That's not how these things work.
All right, this is my reply to her reply.
Hi, other dermatologist here. A lot of people tagged me in his original video. This one is like even more mired in misinformation and also misunderstanding.
She's just doing her job. Her hands are a little bit tied because she works with companies like Neutrogena that sell toxins on the daily.
First off, here he's questioning Dr. Suarez's credibility by essentially saying she's been bought. Everything is a toxin in the correct amount. Water can be toxic. Using fear-mongering words like that really, it means nothing. And this is coming from somebody who has no qualifications to be talking about any of this. Also sells coaching. Coaching on what? I don't know. You're not a medical professional.
I'm also not even going to talk about Accutane in this video because it's just so ridiculous that anybody would promote Accutane. It's been proven to be a toxin to several of your organs in your body, and I would argue to say all of the organs in your body. There's a reason that when you take Accutane, especially if you're a woman, or I guess only if you're a woman, you have to take birth control because it causes birth defects. Why do you think it causes birth defects?
You don't even want to talk about Accutane? You shouldn't talk about Accutane. It's a prescription medication, which clearly you don't know much about. He says it's been proven to be toxic to all of your organs. This is not true. Just like every other medication, it has potential side effects. Like with any medication, you're gonna weigh the risks and the benefits. I've treated hundreds of people with isotretinoin. That's the generic name for Accutane because where I practice here in the US, there is no such Accutane brand. In case anybody was gonna accuse me of being bought by some pharma company over this. Also, let's be a little bit more precise. You don't have to take birth control necessarily as a woman on this medication. Some women can't get pregnant. You could also pledge abstinence. Also, not everybody who can get pregnant identifies as a woman. Again, many substances can cause birth defects and can be beneficial when taken by somebody who is not pregnant, including like life-saving medications. That's not a reason to tell people to never use those things.
When you apply retinoic acid topically, especially in high amounts, it confuses your epidermis, your keratinocytes, that it should not mature to a corneocyte. I also don't care if I pronounce any of these correctly because the science is correct.
You actually should care if this is so important to you. The tretinoin, when applied to the skin, leads to a more organized differentiation of keratinocytes throughout the epidermis. You could refer to keratinocytes as corneocytes once they lose their nucleus. This happens as our skin cells mature. I think maybe he's confused by the fact that the stratum corneum itself does get thinner when retinoids are used. That doesn't mean the skin is confused. It's just more compact.
We also know that retinoic acid is exfoliating, so the daily use of it compromises the epidermis by removing the stratum corneum.
Also not true. Retinoic acid is not exfoliating. Again, compacted stratum corneum, thinner stratum corneum, but more organized epidermis overall. This is not exfoliation. It's compacting.
When you're looking at any retinoic acids, there's normally a disclaimer talking about sun sensitivity because it hurts your epidermis. The thing that's creating sun sensitivity is not anti-aging or creating healthy skin.
Interesting fact here, there's never been an actual human case of photosensitivity that's been attributed to topical retinoids. This was a theoretical risk, however, it's never been seen. Systemic retinoids, on the other hand, are photosensitizing.
Retinoic acid also sends a chemical message to your MMPs. If you want to know the full name of that, she mentions it in the video, but they tell them to stop tearing down collagen. This is why I use the metaphor of the house, of building a house on rotten boards.
Matrix metalloproteases, it's not hard. The collagen levels in our skin are actually the result of a complex interplay of several different processes. Matrix metalloproteases are one of those that break down collagen, and it's not a perfect mechanism. That's why they're implicated in creating acne scarring, and also part of the reason why, over time, we get more collagen breakdown than buildup, and we have less collagen in our skin as we age. Treatment with retinoids is associated with greater collagen mass within the skin. This is most likely the mechanism for its anti-aging capacity, and also why it works on acne scarring, also to prevent acne scarring too.
You are not allowing that dead collagen, that bad collagen, unhealthy collagen to get recycled, and you are just forcing the skin, forcing the fibroblasts to produce collagen, new collagen, on that dead collagen. Over time, this is what leads to your dermis thinning, and it leads to structural collapse.
There's no such thing as dead collagen. Collagen's a fiber. It's not a cell. It was never alive. And your analogy of the house really doesn't work. The collagen in the skin of people who are treated with retinoids tends to be better organized and more abundant. You should throw this whole, like, building a new house on old boards analogy, like, throw it out. Throw it in the trash.
When people take something like retinoic acid for many years, you see those same people also take Botox because the skin cannot hold. Your face cannot hold the skin up after a while.
Botox does not hold your face up. If you're talking about an association between using retinoids and going for cosmetic procedures, I wonder if those people are self-selecting as they're concerned with the signs of aging. As somebody who administers Botox, people aren't coming to me saying, like, oh, my skin is sagging from years of using tretinoin.
Topical retinoic acid also damages our protective melanocytes.
I'm gonna need a reference for that. Retinoids do normalize melanocyte function, and it's been shown that they're a great tone-evening ingredient. They're not destroying melanocytes. They're normalizing their function.
So it talks about how vitamin C is not necessary past a certain small amount unless you have scurvy. Linus Pauling's work from like 40 plus years ago has very much talked and disproven the fact.
He clearly has no idea how vitamin metabolism works. Hyper big doses of vitamin C has never been linked to any health benefit. At the very least, since it's a water-soluble vitamin, you're probably just gonna pee it out.
Glad she kind of did agree with me on the non-nano based zinc mineral sunblock being the best option, but she wasn't able to fully go there with me.
Oh, you were talking about zinc supplementation. Again, taking super high doses of anything, even if it's something that's necessary for the production of collagen, is not really going to do much for you. Do not just start blindly taking supplements. Talk to your own doctor about that. Some of them can interact with medications. Some of them can have negative outcomes for specific health conditions. Oh, and something I've been talking about a lot lately, there's no such thing as sunblock.
Amino acids, especially in the right ratios, and the 8 essential ones in a supplement, godsend for your skin.
Another thing that doesn't have any data behind it, if you're eating like a regular diet, it should not be a concern.
Also talked a lot about like, this is used to treat this is used to treat this, as like a reason for why it's a good thing. She's gonna be freaked out when I say that I'm not a fan of chemotherapy.
So are you saying that cancer patients should just like die? I don't get the point here.
My partner went to allergists and dermatologists with her long-term eczema, and they suggested immune therapy and topical steroids. I'm really glad that we said no and we did the holistic route.
I obviously can't speak to his partner's specific situation, but I've seen this sentiment around a lot. It's interesting that people will like go to a doctor and then be surprised when they're going to prescribe medication.
I've been waiting for a dermatologist to do at me.
Well, now you have two. Like, this is really Dunning-Kruger effect at its finest. He's clearly like learned some things about skin biology, but having the very basics does not mean that you can then start broadly recommending things to people. There are literally like hundreds of years of research behind our understanding of the skin, of the human body, and we're still learning new things every day. I think it's really interesting, somebody who has no background in it and has just, done their own research thinks that like they know better than people who have researched this for years. I really just don't understand.